we think that's what's going on, that really everybody is really stressed. And that's what we're seeing. So if we look at what I put up earlier, these are the problems that people have. And it leads to certain corollaries then about what they need. They need to develop safety skills, emotional management skills, cognitive skills, communication skills, leadership skills, judgment skills, and learn how to grieve and use their imagination to let go of the past. That's pretty complicated work, especially if you're supposed to do it in like 4 days. It's really complex. And who's supposed to supply those complex interventions? Well, first, it's parents and families. That's who should be laying the groundwork for healthy development in the first place, right? And if that doesn't work out really well, then people end up in our services. How are families doing in America? Well, a recent study shows that most Americans, no matter where they are in the income bracket, no matter what gender they are, how old they are, they don't really get how much the wealth of this country has become concentrated. Don't really know. There has been an astounding 36% drop, and this was a year ago, in the wealth of the median household since the peak of the housing bubble in 2007. All households in the middle of the scale saw declines, while those at the very bottom just stagnated. And in contrast, the wealth of the top 1% of the households only dropped by 11%. So the gap gets wider and wider and wider with every passing year. As of 2012, the wealth distribution is even more unequal than it was 5 years ago. The Center for Economic and Policy Research concludes that the decade from 2000 to 2010 was basically a lost decade for most Americans. And I'm sure probably everybody in this room can relate to that. The median household income after inflation fell to $50,000, a level that was 8% lower than in 2007, the year before the recession took hold. And again, this is data from last fall. All right, so what do we got? Well, there's a broad recognition that the current poverty line falls far below the amount of income is actually needed to make ends meet. As of 2012, the New Jersey minimum wage is $7.25, unless you get tips. And if you get tips, all you get is $2.13. Now, the Center for Women's Welfare at the University of Washington has defined a different standard. They call it the self-sufficiency standard. It defines what it actually costs to supply your basic needs and not have to depend on public subsidies or your mother to babysit. Okay, it's just basic housing, childcare, food. No luxuries, no vacation home, none of that, just basic needs. And they do it from state to state. The latest one I could find on New Jersey is from 2008, so it reflects information from 2006 and 2007. So it's probably worse now because of the recession. So this is from the Pennsylvania one, which is newer. It's from 2010. And you'll see if you live in Philadelphia, you have to make $25.90 an hour. If you live in Camden, you have to make basically $22 an hour. Got a lot of jobs here going for $22 an hour? Probably not. 1 in 5, and this is the report from 2008, 1 in 5 New Jersey households are suffering from, it's called income inadequacy. And in those families, there are at least one person who's working. Households with children account for 62% of those with income inadequacy. 94% that are below the self-sufficiency standards don't receive public assistance. And women have the higher rates of income inadequacy, as do people of color. So here's just some scales that I took from this. This is the percent of households in all of New Jersey, not Camden. And you can see by race and ethnicity, the percent of households below the self-sufficiency standard. It's really very high for Latino folks and African American. This is by household type. So if you're a Latino woman trying to raise kids, you're 70% below what it takes to just meet basic needs. And if you're African American woman with kids, you're 65% below. So it's really not fair. This was for Camden specifically, Camden County. 45% of the total population were below the standard. Not good. And in Philadelphia, nearly 62% of Philadelphia households take in less than $50,000 a year. And by these standards, if you have 2 adults with 1 school-age child and 1 preschooler, your annual self-sufficiency income combined has to be $59,000. So you can see why people are having, when you look at the numbers, it explains a lot about why people are having such a struggle. The self-sufficiency standard shows that for most parents, earnings that are well above the official federal poverty level are nevertheless far below what is needed to meet their family's basic needs. So what does that mean for all those people? Well, it means how many jobs? 1 job, 2, not 1 job. They're going to have 2 jobs, they're going to have 3 jobs. Who is going to take care of the kids? Kids need grown-ups. And if they can't afford to live, the only way they can afford to meet basic needs for their family is to have 3 jobs. Well, who then is going to take care of the kids? And then we wonder why there's so many problems in the schools and on the streets. Well, what do we think? This is what he's talking about, the congressman is talking about how we've just normalized this, and somehow this kind of maldistribution of wealth is okay. What accompanies poverty, which is really a form of structural violence? Inadequate parenting, because nobody's there. They don't have time. They're exhausted. Divorce and family disintegration, a product of a lot of stress. More crime, more substance abuse, drinking to make your problems go away, deterioration of property value, poor health, physical and emotional, shorter lives, and the multi-generational repetition of that. That's what we've got, and that's what in America we call normal. That's what he's talking about. So, if people don't get it in their homes because of the stresses that the family's under, then they show up in all of our services. So who then is supposed to supply those complex interventions? Look around the room. It's all of the people who provide all different kinds of services, including corrections officers, probation, parole, and law enforcement. So everybody is seeing the folks that I was talking about this morning, because they're in every system and they're in this room and they're us. It's not some other small group of people. It's a major public health issue that we have going. So, what's required of parents, families, and all of us who provide services? Well, you need secure, reasonably healthy adults who have good emotional management skills, who are smart both intellectually and emotionally. And if you have to pick one, pick the emotional intelligence one. Who are able to actively teach and serve as a role model for what it is they're teaching, who are consistently empathetic and patient, who are able to endure doing intense emotional labor, and who are self-disciplined, self-controlled, and never ever abuse power. So how we doing, folks? There it is. There's the problem. It's not that people can't be helped. It's not that people can't recover and get better. It's that the structural violence and all of it that comes down has made it virtually impossible to do that. Just as you get on the point of having a successful program, what happens? Anybody? You lose your funding. How many people in the room has that happened to? Show me your hands. Yeah, exactly. You do. Something's wrong with that. The reality is that a growing proportion of the U.S. workforce will have been raised in disadvantaged environments that are associated with relatively high proportions of individuals with diminished cognitive and social skills. So we are in a workforce crisis in all of our helping services. And then there's workplace violence. 48% of all non-fatal injuries from occupational assaults and violent acts occurs in healthcare and social services. After law enforcement, people employed in mental health. How many of you are in the room? People who work in mental health. The highest rates of all occupations of being injured while you're at work. Do you get any dangerous duty pay? No. And then there's this. This is workplace stress. And I'm sure everybody can relate to this. Just funding issues and more paperwork and too many demands and change. It doesn't lead anywhere, and unclear policies, and it's just a mess. So that's what everybody has. So you end up, as a result, with caregivers who look astonishingly like the people they're supposed to be helping. And then move up a level to our organizations. Organizations are currently treated as if they were our machines. That is the mental model that we use to understand organizations. Thing is, they're not machines. They are living systems entirely comprised of living beings, all of you and everybody else you know. So it's not a metaphor. It is actually the way it is, but it is not the way we think of organizations. So that's the way I challenge you to think about them now, as living creatures that are comprised of, just as you're made up of billions of cells, and out of that emerges you. Who would predict from looking at one of your cells? So too in an organization, everybody in the organization, even everybody who has ever been in the organization, comprises this living system that is where you work, or where you go to church, or where you go to school. They're all living creatures of a different magnitude, of different order. What that means to me is that families, organizations, and communities, like individual people, are living, complex, adaptive systems. That means they're vulnerable to stress. They're going to be particularly affected by chronic and repetitive stress, and they can be traumatized. And the result of traumatic experience can be as devastating for an organization as it is for individuals. That's my basic premise. So, what causes organizational trauma? Oh, you know. It's suicides, homicides, other deaths, lawsuits, loss of funding, other injuries, episodes of sexual abuse, media attacks. There's probably more you could add to it. And you probably have worked within or functioned within a traumatized organization, because pretty much everybody has. What happens when it happens over and over again? You get chronic trauma and stress. And I call that organizational hyperarousal. And it's very similar to the chronic hyperarousal that I talked about this morning with all those chemical changes. What does it look like? Well, it looks like everything's a crisis. So it looks like the people within the organization can no longer tell what is a crisis and what isn't. So they're responding all the time until they burn out and just stop responding. Because, you know, oh yeah, another death, another loss, another homicide. Yeah, well, nothing we can do. It's kind of hopeless. And what emerges is a lack of safety and basic trust. And they go hand in hand. Now in Sanctuary, when we talk about safety, we don't mean just physical safety. Physical safety is one of those things that's necessary but not sufficient. So you need it. You can't have safety without physical safety. But what you'll find is that there will be erosions of moral safety, social safety, and psychological safety, and that will emerge then as a loss of physical safety. So unless you pay attention to issues of basic trust between people and how we can be safe with each other, then the environment will simply become more and more and more dangerous. And that is exactly what happens in organization. When that's happening, people demonstrate that emotionally in all different kinds of ways. Everybody's an individual. So some people are chronically scared. Some people are losing their temper all the time. Some people are burying their head in the sand. All different kinds of emotional response. But what it means is emotional distress, that you see rising levels of emotional distress. And we deal with that as best we can as individuals. But when this happens at an organizational level, communication starts to break down. In your body, your communication is through your veins and arteries. And if any of them get blocked, you start to die. And that's what happens in an organization. When feedback loops in your body erode, you start to die, or you do die. In an organization, the same thing happens. You need these constant channels of open communication so that information is flowing to every part of the organization that requires it. Does every part require all information? No, it would be kind of overwhelming. But the channels have to be open to keep information flowing. When it breaks down, everybody's risk that bad things are going to happen increases. It doesn't decrease, it increases. And there's no simple solution to decreasing that risk. It's kind of like we need law enforcement. But thinking that law enforcement is the only solution to a complex problem is naive. That won't work. It's not enough. You'll burn out all the police officers before you actually have done anything about the problem, just because it's complex. You may need more police officers as one part of the strategy. It was what the congressman was talking about. It's not either or strategy. You need lots of different strategies, particularly to reclaim our cities. Okay, so when this is happening, what happens to conflict? Ooh, it just starts to skyrocket, but not the right kind of conflict. What we get, oops, too fast, is we get more interpersonal conflict. So we start getting really angry with each other, with the people we can see and we're closest to, and attribute the problem to them. And as there's more and more interpersonal conflict, you don't get the rich kind of discussions where you're really trying to solve a problem from multiple different points of view and then doing the harder work of integrating all that. That doesn't happen. So there's this inverse relation. The more interpersonal conflict, the less task-related conflict. That's what it's called. As that situation continues to deteriorate, you get whatever is called a team may still be a team, but it's in team in name only. You get together for a meeting, but nobody wants to go because it's useless and pointless. Really what's happening is that the team is just disintegrating. And I call that organizational dissociation, that the loss of integration is profound and it's happening at an organizational level, not dissimilar to what happens to individuals. And then you get amnesia. So we forget. We forget the things that worked. We forget the things we used to do that were very effective. We just don't remember it anymore, and we have to rediscover everything all over again. In mental health, I'm old enough now to have watched this happen several cycles of forgetting and remembering and doing the same thing over again and then forgetting and then, oh yeah, we have to learn all that new again. And it's like generational too. So if you don't pass things on from generation to generation in a family, in an organization, the generation of the new workers. So if you don't pass on the knowledge, it's lost. All you have to do is not pass it on for one generation, and it's gone. That's organizational amnesia. And that means we are destined to repeat our past, whether it's effective or not. We're going to reenact stuff that doesn't work because we forget that it doesn't work. And don't do anything new, and don't take the energy to innovate, which is what's really required. As that happens, people get demoralized and they walk away. They stop stepping up to the plate. It's wonderful that all of you are here. You need to remember you're going to have to be here more than once. And that's the hard thing to do, is that it's really easy in the face of everything I'm talking about to just go, oh, it's just too much, and to walk away. And say, I can't, it's too much, We're helpless. We can't do anything. We're just victims. It's terrible. It's awful. It's never going to get any better. That's what easily happens in an organization within which this is all occurring. And what it actually is that people have become robotic, and they've lost the ability to think collectively about how to solve complex problems. And there's no way out of this box. It's going to take a lot of collective effort to resolve the enormity of the problems that have been accumulating now for decades. And if this doesn't stop, if this goes on, then you see the really, really noxious stuff. Dissent is silenced. You get leaders being more and more authoritarian. Bullying becomes the norm. Then you've got an environment that overall is more aggressive in all kinds of ways. That's how you can get a hostile workplace. Just from stress, just from the chronic effects of relentless stress. If it goes too long, then what you can get is complete demoralization and a system that just collapses. And that has happened in the past and will happen in the future if we don't do something about it to stop it. Living systems, you got to remember though, and that's where this is so important, living systems can become very, very sick, and then they can get well. But it doesn't happen exactly through magic, maybe a little magic. We call this whole thing creating sanctuary trauma. And that's where the word sanctuary came from. It came out of the first chapter on the inpatient treatment of Vietnam vets. And this guy who was a psychologist at the Coatesville VA, he said, that's what Vietnam vets experienced when they came back from Vietnam, sanctuary trauma, expecting a protective environment and finding only more trauma. And I read that and went, that's what the people we treat have experienced. And sometimes it's been in our place. So what will it take to create a safe environment? Okay. That's at the heart of destroying sanctuary. Now, we want to do what we did earlier today. You know the rules now, right? You got to pick somebody to take notes. If the same person is getting overwhelmed, doesn't have to be that same person. Go around the table. You're going to have 2 questions, 15 minutes each, and we'll let you know at the 10-minute mark. These are the questions. Have you seen the things I just talked about happening at your workplace? We want 3 examples. Have you seen these things happening in your community? Give 3 examples.